The Disparities Leadership Program, Empowering Leaders, Getting to Solutions. Brought to you by the Disparities Solutions Center, the National Committee on Quality Assurance, and Joint Commission Resources. Hello, my name is Joseph Betancourt. I'm Director of the Disparities Solutions Center at Massachusetts General Hospital. I'd like to welcome you to the Disparities Leadership Program Informational webinar. By way of background, the Disparities Solutions Center was established at Massachusetts General Hospital in 2005. We're dedicated to developing and implementing strategies to eliminate racial and ethnic disparities in healthcare locally, regionally, and nationally. We aim to serve as an agent of change by translating existing and ongoing research on strategies to eliminate disparities in policy and practice, developing and evaluating customized solutions to address disparities, and providing education and leadership training to expand the community of skilled individuals dedicated to eliminating disparities. Today we share with you our vision about the program we've been leading for the last 6 years entitled the Disparities Leadership Program. The goal of the Disparities Leadership Program is to develop a cadre of leaders from hospitals, health plans, community health centers, and other organizations who are equipped with the knowledge of racial and ethnic disparities, including root causes and research to date, cutting-edge quality improvement strategies for identifying and addressing disparities, and leadership skills to implement and transform organizations to improve quality, address disparities, and achieve equity. We hope through our program to assist individuals and organizations to create a strategic plan to address disparities or advance or improve an ongoing project on disparities, as well as be prepared to meet new standards and regulations from the Joint Commission, NCQA, healthcare reform, as well as payment reform. The Disparities Leadership Program has several main objectives. We hope that at the conclusion of the program, participants will be able to identify ways to secure buy-in from leadership to address disparities, list techniques for race ethnicity data collection and performance measurement and monitoring, describe interventions to reduce disparities, become familiar with strategies to message the issue of disparities internally and externally, and develop concrete steps to address disparities within their organizations. The Disparities Leadership Program occurs over 1 year and begins with an opening meeting in May in Cambridge, Massachusetts. Organizations that are selected come to Cambridge for a 2-day opening meeting. Details will be provided more in a few minutes. In June, organizations complete their project work plan, which is the guidepost for what they will be accomplishing over the course of the year of the Disparities Leadership Program. In July, organizations come together as part of collaboratives that are established at the opening meeting for a group conference call where they share their projects, progress to date, and lessons learned. In September, the Disparities Solutions Center team of faculty carry out individual calls with organizations, providing customized technical assistance on organizations' projects and plans. In October, we conduct a Disparities Leadership Program-wide web seminar on a topic that is chosen by current Disparities Leadership Program participants. In November, we conduct another collaborative group conference call where the groups come together once again to report on their progress and lessons learned. In December, thanks to a memorandum of understanding we have with the Institute for Healthcare Improvement, we bring 2 or 3 of our top organizations that are part of the Disparities Leadership Program to the Institute of Healthcare Improvement's annual forum. At the forum, we have the opportunity to showcase these organizations, and they get a chance to present their work to a broad national audience. In January, we conduct another individual team call, providing customized technical assistance to each organization. And in February, there's the final face-to-face meeting where organizations come together, present their work, share lessons learned, and fine-tune their skills on organizational transformation. In March, we conduct our final web seminar for the entire Disparities Leadership Program. And in April, we have our final collaborative call, individual technical assistance call, and final reports are due. A little bit more about our opening meeting in Cambridge in May. We have several special sessions that are geared towards providing participants with the key tools and skills they'll need to improve quality, achieve equity, and address disparities at their organizations, including a session on Introduction to Disparities, which provides a state-of-the-art and the latest cutting-edge research on racial and ethnic disparities in healthcare, along with background and root causes. We have a special session on how to collect race, ethnicity, and language data, and have expanded that now to new areas such as collecting data on disability and hopefully soon sexual orientation. We have a special session on communications with a focus on how we communicate activities related to disparities and equity, both internally within our organization and externally to the local community and the national community. We have a special session on using your data, how organizations who engage in projects can use their data and eventually publish it in a peer-reviewed journal. And finally, at our open session, at our opening meeting, we have a special session where alumni from the Disparities Leadership Program present on their work and, more importantly, share what they got from the Disparities Leadership Program and how current participants can make the most out of their upcoming year in the program. We have special panels as well, where we bring together local, regional, and national leaders on several topics. And these include how to get disparities on the leadership agenda, where participants will get to hear from leaders from hospitals, health plans, and health centers on how these issues can be communicated and how we can get them on the leadership agenda. We have a panel on measures and reporting, which focus particularly on how to develop disparities dashboards, equity reports. Panel on interventions, where we get to hear from local and national experts on interventions they've developed to address disparities, as well as experts who will talk about how to create systems that are responsive to the needs of diverse patient populations, including issues related to patient experience, multicultural advisory boards, and other particular issues, including language and interpretation services. We ask that all individuals that are part of the Disparities Leadership Program review capsules that we prepare for them about these special panels prior to their participation in the Disparities Leadership Program, so that we as moderators of these panels can engage the leaders in facilitated discussion, and then participants can spend time engaging those leaders directly in Q&A related to issues that are most important to them. Long way of saying that a key component of the Disparities Leadership Program is preparation and pre-work. As I mentioned previously, we break organizations based on organization type or project type into collaborative groups at the opening meeting. These groups meet as part of the opening meeting, share their projects with their peers, and have 2 assigned members of their team who provide critique, guidance, and constructive feedback. The group then adds to that constructive feedback, and the hope is that each participant will leave with a fair amount of constructive feedback for how they could improve their project and be successful over the course of the Disparities Leadership Program year. Our final meeting, which occurs in Santa Monica, California in February, again brings all the participants together where they present their projects, have some final collaborative breakouts, and we provide awards to some of our top Disparities Leadership Programs. To date, we've had a fair amount of experience training organizations in this area. Our Disparities Leadership Program now will have trained 190 participants from 89 organizations, including 44 hospitals, 19 health plans, 17 community health centers, 1 hospital trade organization, 1 federal government agency, 1 city government agency, and 6 professional organizations. We've had representation from 28 states, along with the Commonwealth of Puerto Rico and the country of Switzerland. The final report from our 2011-2012 Disparities Leadership Program class reveals that participants gain a lot from participation in the program. If we look at project goals and objectives, we see that 94% of DLP participants accomplished the majority of their project goals. 94% said they had concrete and positive outcomes from the Disparities Leadership Program project to share within and outside their organization. And 88% agreed or strongly agreed that the Disparities Leadership Program played a significant role in accomplishing their goals and objectives. In terms of broader impact, which we always see and expect, 100% agreed or strongly agreed that the Disparities Leadership Program helped in other ways aside from their particular project. And 88% agreed or strongly agreed that the Disparities Leadership Program was beneficial in terms of networking and developing collaborative relationships. If you'd like to learn more and hear from our participants in particular, feel free to come to our website. The link is provided here, www.massgeneral.org/Disparities Solutions Centers /DLP program _videos.html, or you could just go to www.mghdisparitieSolutionsCenter.org and click on Projects, and you will hear testimonials from past Disparities Leadership Program participants. To apply, we ask that individuals submit a letter of intent. This letter of intent is encouraged but non-mandatory. And if you're watching this web seminar now, the date has passed for the Disparities Leadership Program letter of intent, but we still encourage you to go ahead and send the letter of intent if you are interested. The formal application includes a series of essay questions that are short yet provide the Disparities Solutions Center with some background about your organization, the type of project you want to conduct, your background and experience in this area, and information about the team. Just to highlight, we encourage teams of 2 from organizations to apply and participate. We ask for senior leadership sign-off from your organization, and tuition is $9,500 per person. This covers all program activities, including 2 two-day training sessions, the opening meeting in Boston, as well as the closing meeting in Santa Monica, California, conference calls, web seminars, and program materials, as well as 2-night hotel stays and meals at the opening and closing session. Limited partial scholarships are available, particularly targeting organizations such as public hospitals and community health centers, as well as Medicaid managed care plans. Nevertheless, we encourage individuals or organizations who are interested in learning more about our scholarship program and who aren't part of those organizations to reach out to us, and we'll be happy to provide you with more information and let you know if those opportunities are available. To conclude, we're anxious and hopeful that you would consider applying to the Disparities Solutions Center's Disparities Leadership Program. Again, for more information, you could quite simply go to www.mghdisparitiesolutions.org. There you will find all the information I've covered here, but in a fair amount more detail, including timeline, background, tuition, selection criteria, faculty, information on scholarships, continuing education credits, and some of our other sponsors. With that, we thank you so much for your time and attention. We hope we get a chance to work with you in the year to come. For more information, we ask that you contact Sweta Tan-McGrory, the Deputy Director of the Disparities Solutions Center. She could be reached at Tan-McGrory, ATANMCGRORY @partners.org, or directly at 617-643-2916.